and KHNA for giving me this great opportunity to speak about something that I'm really passionate about. And thank you everyone for joining in. For the interest of all my friends who are non-Malayalam speaking, I'm trying to keep the speech in English. But if you have questions in Malayalam, you can always I can always address that at the end of the speech. Okay, so let me try and share my screen. Can everybody see my screen? Okay, so as Nandan said, today's topic is regular dental visits. And I want to stress that it's always it's for more than just a beautiful smile. And throughout this presentation, I'm trying to tell you why dentistry is not just about drilling and filling teeth, or a dentist is someone who just makes money, but it's way more than that. Okay, and I hope I'll be able to make you understand that that's dentistry, what dentistry is all about. Okay, so let's move on. So when you talk about dentistry or dental visit, is it a luxury or is it a essential healthcare need? Well, let's find out. Okay, so today I'm going to focus on, I want to give you an introduction about different fields of dentistry, because when you talk about dentistry, you only know about a dentist, right? But there are different fields in the field of dentistry. So we'll talk about that, and different perceptions about dentistry, and how oral health affects general health, how the general health of a person affect the oral health. And I cannot move on without talking about oral cancers and oral cancer screening. And I'll also talk about some challenges in the field of dentistry that we face, and some tips on regular dental hygiene. Okay, so as you can see here, general dentist, or what we call people doing a lot of dental work, we call comprehensive dental care, comprehensive dentist. Okay, they take care of a lot of your dental care needs, and they do a lot of specialist work as well. But if you need further expertise, there are about 12 fields of dentistry that are approved by the American Dental Association, like endodontist, orofacial pain specialist, medicine. We'll get into each field a little bit so that you get an idea about what dentistry is. Okay, so as I said, there are general dentists who does a lot of work, and but there are other specialists as well. So one of the specialists is endodontist, and most of you know that they are the root canal specialist. Okay, so we do whatever we can to save our tooth, right, our teeth. So the teeth that are affected by dental caries, when the caries goes into the pulp, inside the pulp chamber, we do, dentodontists are very valuable in helping to keep or preserve that tooth by treating the inside of the tooth. Okay, so that's what they use root canal instruments. They clean up the root canal of the tooth and help to preserve that tooth so that you don't have to extract the tooth. And it's a very advanced field. Most endodontists now also use microscope. As you can see here, they use microscopes to perform their procedures. And they do endodontic surgery procedures. Every field of dentistry is very well advanced. So next comes the prosthodontist. Prosthodontist, when you see prosthodontist, there's fixed prosthodontist, removable prosthetics, but generally most of the work that prosthodontist or any other specialists do, general dentists, like you don't need a prosthodontist to make a denture, but when you need complex reconstruction of the mouth, for example, what I'm more concerned, or we generally as a surgeon, I regularly keep in touch with prosthodontists for maxillofacial prosthodontics. They play a very important role in the reconstruction of patients who've undergone cancer resections. You can see how a patient here is transformed with a simple prosthesis. And you can see here if you can see the picture, sorry. If you can see the picture, can you see my mouse moving on the screen?
Yes.
And then you see
Yeah.
my mouse. Okay. So if you can see the picture on the extreme right here, that's a patient who had undergone cancer resection of the upper jaw, and there is a hole in the jaw, right? So what happens is when patient eat food that comes through the sinus, through the nose. So these prosthodontists, they make obturators or prostheses that fix the holes, and that improves the quality of life of the patient tremendously. And they also helps in implant supported dentures when you have dentures that don't fit or it comes off easily, then because your jaw is treated, then you can put implants around and fix the denture on top of that, and so it stays well, and that also tremendously improves the quality of life. Then you have orthodontist, as you all know, they are the braces dentist. They are also very well trained in aligning your teeth, not just aligning your teeth. They play a very important role during even development. Even before you start braces, if you see an orthodontist, they may be able to change the way your jaw is developed. That means you can expand the jaw, constrict the jaw using certain appliances so that you may not need braces later in life. And we also work very close with orthodontists for performing what we call an orthognathic surgery, which is a jaw surgery that moves and aligns your skeletal part of the or the jaw, not just the teeth. Okay, later I'll show you more about orthognathic surgery. Then we have pedodontist. Everybody loves pedodontist. You need a lot of patience to become a pedodontist because you're dealing with children, and children in dental clinic, they don't like, most of the time they don't like it, but pedodontist are specialists who take care of these young ones, and they play a very important role in giving a good dental experience in your childhood. Most of the problems that you face in later life, especially dental phobia, a lot of people develop dental phobia because of bad experiences at the dentist early in life. And these periodontists are especially trained to take care of dental anxiety in children. They're also trained to take care of children with special needs. So they're also a very important part of a community. And we have dental anesthesiologist. So dental anesthesiologist, anesthesia has developed into a specialized category of field of dentistry where anesthesia is given by trained specialists. A lot of specialists are also trained to give anesthesia, like oral surgeons. We do periodontists, we administer anesthesia, endodontists administer anesthesia. But in cases where you have more compromised patients, medically compromised patients, and you need expert care, we get the consult from dental anesthesiologists. They are trained in administering sedative drugs, IV sedative drugs. They're trained in managing complications. Sometimes as a surgeon, when you're practicing, you need another person to monitor the patient. You can't be doing surgery and monitoring the patient under sedation. So you probably get your anesthetist friend to help. Now, periodontics. So although I'm an oral surgeon, I'm moving into this field, which is periodontics, who takes care of your gums. Okay, so not just that, there's a lot going on. It's a very advanced or advancing field of dentistry, a lot of research going on there, very evidence-based dentistry. Apart from taking care of your receding gums or your gum diseases, periodontists are very significant in your implant treatment. Implants are mostly placed by periodontists and surgeons, and even general dentists place implants, but complicated cases are done by many of these specialists. And we also look at if you need a reconstruction, if you need extra support for your tissues to receive your dentures, then a lot of grafting procedures are done. And as I said, it's a surgical field. Aesthetic dentistry, I don't think it's an ADA approved field. I just wanted to put up there so that you understand what is aesthetic dentistry. It's more of cosmetic. Although it is cosmetic, it plays a major role in improving the self-confidence of a person, right? You can see different before and after photos here. So like tooth whitening, veneers, they're all trained to do very aesthetic work with a lot of finesse. Okay, so that aesthetic dentists also play a very important role in especially in your mental health. Now comes my field, that is oral and maxillofacial surgery. I would like to say that oral and maxillofacial surgery is a bridge between medicine and dentistry. In different parts of the world, oral and maxillofacial surgery is practiced slightly different, not practiced, taught slightly differently in the sense that in Asia, a dental training is enough to become an oral surgeon, whereas in Europe and US, in US there are two streams. You can either be a dentist and become an oral surgeon, or you have to undergo 6 years of additional training to be an oral surgeon. Then you get an MD degree as well. So you can see when you go out to see oral surgeons, they may be oral surgeons with an MD degree. They have gone through 6 years of training, and there could be oral surgeons who've gone through 4 years of training. They don't have an MD degree, but pretty much you do everything similar. It's just that I think oral surgeons here without MD degree don't treat oral cancer patients. But me being trained in Asia, we had a lot of exposure for all kinds of conditions. We had trainers who were trained in, who were specialists in oral cancer care. So I got the exposure to work with a lot of cancer patients. We deal with fractures, trauma. You can see how the jaw is fractured there. So we fix all the facial fractures, and sometimes you need to do such degloving and surgeries to get to the fractures or to treat other conditions. And of course, all of you know that we are specialists in removing wisdom teeth. And my husband jokingly says that you can be blindfolded and take a wisdom teeth out because of the number of wisdom teeth that are removed. And then you can see we treat, deal with infections, implants, a lot of it's just the tip of an iceberg. I'm just giving you a broad picture. And we also treat cleft palate patients, not in the early stage, but mostly towards a secondary reconstruction. Kids who, with the lip and palate who treated early, but sometimes they have a cleft that is left in the jawbone, upper jaw, later part of life. And one of the gold standard treatment for that is we take bone from the hip. That's a hip graft. Okay, take the bone from the hip and mix it with other bone components, and then fill that gap. And you also work with the orthodontist to give them a better aligned teeth. Now, this is a very popular form of surgery that we perform as oral surgeons. That is called orthognathic surgery or jaw surgery. Sometimes your teeth, the malalignment is not just because of the teeth that are malaligned, but because of the way your jaw grows, right? So here you can see this boy, he has a lower jaw, which is longer than the upper jaw. So if you correct the teeth with braces, that's not enough. So you need to cut the jaw and upper jaw, move it forward, and lower jaw move backwards. So it has tremendous influence on the patients. And you can see here how the gummy smile is treated, right? So all these help the patients to achieve better self-impression about themselves, better confidence. And I'm just proud to say, show you what we do as a community. And there are also oral medicine specialists who are involved in diagnosing many oral mucosal conditions, oral pathologists who examines our histological specimens. The biopsy specimens that we take are sent to oral pathologists who are specialized in diagnosing various pathological conditions. Then there are oral pain specialists, orofacial pain specialists who specifically deal with orofacial pain, here temporomandibular joint disorders. Then there are oral radiologists who are trained to look at or give expert opinions about oral radiology when we need second opinion for certain radiographic features. We consult oral radiologist. And then there are dental public health specialists who are one of the most important people in the field of dentistry. They look at the dental needs of a community or dental needs of a country and make policies, dental health related research, and they make sure that the dental needs of a particular community or a country is met. So they are very important. They have a very important role in this field. And as I said, it's what we do is a multidisciplinary approach. It's never one person taking care of the patient. It's always good to have a multidisciplinary approach. We work among ourselves and also with the medical community, not just the dental. We also work with the medical doctors to bring the best care for the patients. Now, I just want to talk about some perceptions. There are a lot of perceptions about dentistry, but when you talk about dentistry, people think that, oh, dentistry is just about teeth, right? So I'm going to take you through certain situations that make you understand dentistry is not just about teeth, okay? And dentistry is a lot more. And then another perception is dentistry is about making money. But you will see the extent of the training and the pain that we go through to become a dentist and a specialist. And so it's not just about making money. And people think that dentistry is totally different branch, not at all related to medicine, but that's not the case. It should be a branch of medicine, actually. Now, as I said, the teeth do not function in isolation, right? I've never seen teeth walking into my practice without its human owner, right? So it should always be considered together. Or I would say that teeth and the related structures, associated structures, they are the most accessible or most obvious, they provide most obvious warning signs for breakdown that's happening elsewhere in the body. I can show you some examples of how oral health affect dental health. Now, gum infections, as you know, or periodontitis, what we say, there's a lot of research going on in this field. And there has been a lot of associations between periodontal health and various other conditions like cardiovascular diseases, rheumatoid arthritis, asthma, prostate cancer, and in pregnant patients, these periodontal bacteria causing preeclampsia, which, we'll talk about it a little later. And they also causing preterm labor, low birth weight infants, causing Alzheimer's and dementia, stroke. But I would say that the most important aspect of this is diabetes. Okay, diabetes and periodontitis or gum infection, they have a bidirectional relationship. That means severe periodontitis can worsen diabetes mellitus, and worsen diabetes mellitus can cause the periodontitis to be more severe. The association with, I'm not telling here that periodontal bacteria will cause cardiovascular diseases or rheumatoid arthritis, but because I have seen people talking about it, but the evidence suggests that there is an association between these conditions and periodontal infections. There's a lot of research. It may come up later to prove the link between these conditions and periodontal or gum infections. But right now, what we know is there's a lot of associations between these two conditions. Now, why we say that you have to take care of your teeth? So just a small little dental infection, you can see how it spreads. It can spread locally into various, there are there's spaces within your different layers of tissues in the body, what we call fascias. It's spread through the fascias, going to different regions. It can cause swelling of the neck and cause airway compromise. These are all severe maxillofacial infections. It can go down to the heart, it can go up to the brain, causing brain abscess, it can go to the eye, causing blindness. So you cannot take these conditions lightly. They are, most of these infections, spread of infections happen in patients with other medical conditions like diabetes, or where their immunity is compromised. So you can see how, how abscess is drained. This would have, if it was small, it would have been drained through the mouth, but it has grown and come out of the mouth, and you need an extra oral drainage of this patient. And you can see here how the neck has swollen, and such patients will need, sometimes need to put a hole in the, directly into the windpipe. We call it tracheostomy, in order for the patient to breathe. And you can see here, it's spreading down to the heart and brain. And one thing to be aware of is that there is an area in the face called the danger triangular face, where you have veins without valves. So the infection spreads very fast into the brain if it's not taken care of. Okay. Now, another condition that most people talk about or worried about is halitosis, that we call bad breath. Okay, so bad breath, there are various causes for bad breath. It could be certain food that you're taking, like garlic, or certain medications that you take. Poor oral hygiene is a very important factor. And most of the time, it's because of your dry mouth or your coated tongue. And the tongue has a lot of food debris and bacterial remnants and all that. So that can cause bad breath. Gum infections, definitely. And yeast infections, what we call candidiasis. And that's again seen in patients with a compromised immunity, or even patients who are taking steroid inhalers. They can come up with yeast infections in the mouth if not cleaned after using your inhaler. And dentures that are not cleaned regularly, as I said, dry mouth, and tobacco products. All tobacco products can cause that. Respiratory infections. So your bad breath may not be just because something happening in your mouth. It could be due to other conditions like respiratory infections or GI conditions. Then diabetes, of course, and other renal and liver conditions. And okay, this is something that I think most of you are aware of, but I just want to stress the importance of jaw pain, and it could be a warning sign of heart attack, okay, and impending myocardial infarction. So don't take a jaw pain lightly. If you have a jaw pain without a reason, and there are other supporting symptoms like maybe chest pain, may be there, may not be there, may just precipitate as jaw pain, or you feel suffocated, or you feel nauseated, you have other symptoms, definitely pay attention to this. Now, you've seen now how the oral health is generally affecting your general health, and now let's see how the other conditions of the body affect your oral health. So I just put up this slide there, not to gross you out, but just to share some important aspects of different conditions that is manifested in the mouth. So in the first picture on the left, if you see, you can see that's a condition that we always see. It is called a lichen planus, and it's a dermatological condition. It has also manifestations in the mucous region. So sometimes dentists are the first people, or oral medicine specialist, diagnose this and then send to dermatologist for further consultations. So that's there. And then the figure below that, that's ulcerations caused by Crohn's disease. So you don't need to treat the oral ulcerations once you treat the Crohn's disease. That is a GI condition, the gastrointestinal disorder. If that is treated, this will resolve. Okay, and what you can see here, that is a tongue which is of an anemic patient. It can be what we call a beefy tongue. Okay, it's a plain smooth tongue. And there are many other conditions. What you see here, that is actually not something related to oral cavity, but that's a metastatic tumor from a lung cancer. So that's a metastatic lung cancer showing in the mouth. And what you see here in this person on the left side below, that's something that we call Kaposi sarcoma. That is, if you have an AIDS patient, in my academic practice, we see a lot of patients with HIV. And when they present with conditions like that, that's what we call an AIDS defining lesion. So if you have something like that, then you know that the patient is going from HIV to established AIDS. And then you have candidiasis yeast infections. Such widespread yeast infections are again seen in patients with severely compromised immunity. And as I say, the kids who are using inhalers, steroid inhalers for asthma, make sure that you wash your or gargle your mouth after the use to prevent yeast infections like this. And smoking and alcohol, very big impact in the oral cavity. Oral cancer's biggest risk factor for oral cancer is smoking and alcohol together. Yeah, severe periodontitis, you can see sometimes that can be an indication of, again, as we talked about, hematological malignancies. Any of the conditions could be precipitated like that. And then above that here, you can see erosion of teeth. That's when patients have severe reflux disease, like what we call GERD. Then because of the acid reflux, the teeth erodes. So these are some of the, again, it's just the tip of an iceberg. I'm just showing a few cases to show you how dental health affect the oral health. Now the X-rays that we take in dentistry, this is our regular routine X-ray that we take, which is called the optopanorama, OPG. So if you can take a look here, you can see white stuff in the X-ray. That is actually carotid artery calcifications. So you can actually detect calcifications in the carotid artery. We have seen a lot of cases when we immediately refer them to cardiologist so that they can assess their risk for cardiovascular incidents or even stroke. So that's a very important tool for us. And then also many other conditions, like here what you see is a patient with multiple myeloma. So that's a cancer, and hormonal conditions, everything. A lot of conditions can be picked up from these regular X-rays that we take. Now, another condition that I want all of you to be aware of is called medication-related osteonecrosis of the jaw, which is, we call it MRONJ, okay? Why we are telling that is because it's becoming so important, and many of us reaching that age where you need osteoporotic medicines. So medicines that are used for osteoporosis, or medicines that are given to metastatic cancer patients, basically to strengthen the bone. They have a rare side effect. Okay, that's called MRONJ. So basically that is a non-healing ulcer that is presented in the oral cavity. It is very difficult to treat. Not all patients on MRONJ develop this, but if you have to have a dental extraction when you are on treatment, because all these treatments are long-term treatments, right? So when you're on the treatment and you have to have a dental extractions, then that extracted wound won't heal. So that's called MRONJ, and it's due to these drugs which are called bisphosphonates, and there are certain other drugs as well. So why I'm giving it so much importance is because I have seen patients who are on bisphosphonates or any of these drugs who are not informed about this risk. Not all patients develop that, but still the patients need to be informed about this risk. And most of the dental issues should be taken care of before you start medication. So if any of you going into, going to start osteoporotic medicines, definitely see a dentist to see that your teeth are in order. Whichever teeth needs to come out, should come out before you start the treatment, because after you start the treatment, there is always this risk. And we also play a very important role in the treatment of obstructive sleep apnea, OSA. The common snoring, or whoever is diagnosed with OSA, they use a machine called CPAP, right? For them to have that positive pressure ventilation, for positive pressure for sleeping. But it's troublesome having that CPAP machine and sleeping. So in oral surgery, we do this advancement of the jaws to create space in the airway, and very promising results. The only issue is that the surgery is extensive, and you have that period of recuperation. But if you can go through that, it is much better treatment than many other surgical modalities, or many other treatment modalities. Now, some special considerations in pregnant patients and young children. Pregnant patients who have a pre-existing periodontal condition or a gum condition can develop swellings in the mouth we call pregnancy tumors. So it's good to have good oral hygiene during pregnancy. And as I said before, there is an association between preeclampsia and periodontitis. Preeclampsia, as you know, it's a medical emergency. It's an emergency during pregnancy where your blood pressure goes very high, and then protein is detected in the urine, and it can lead to severe multi-organ failures and fatalities. But I'm not telling that this will cause this, but there has been associations, and there have been a lot of research that's going on. And they also have seen a preterm labor in patients with pregnant patients with very bad gum conditions, and also low birth weight in infants. And I also want to mention, if there are any small children, if they have generalized periodontitis, generalized gum. When I keep telling periodontitis, it is gum infection. Okay, so in prepubescent children, without any specific reason, such children should definitely be assessed more for any hematological malignancies. The picture that you see here is actually a small child with acute lymphoblastic leukemia. So that's a common hematological malignancy in children. So this could be an early warning sign. Now, oral cancer, very important. And we as dentists play a very important role in oral cancer screening. Early detection plays a very important role, and the survival rates are very high when compared to cancers that are detected later. Just like any other cancer, oral cancer is very treatable if you detect it in the early stages. So please, when you go for your regular dental checkup, I'm sure the dentist take it very seriously. They're all trained in looking at not just the teeth, but the surrounding structures to look for any abnormalities, which makes a visit to the dentist very, very important, almost life-saving. I just wanted to share with you a story of a very close relative of mine who just passed away from oral cancer. He was detected with a tongue lesion about 8 years back. The dentist saw a tongue lesion, but informed him to see an oral surgeon. He everybody is in denial, right? So he said, no, nothing, I don't have any problems. And it went on, and the dentist, because they were very close to the family, called up the family and told that this is, he's not taking care. You have to take him to the doctor. But nothing happened. And finally, recently, in my last visit to India, I saw that it was in a very, very advanced stage, and he recently passed away. So even very educated people and people who are aware of things don't pay much attention to this. So just be careful. So what are the common risk factors? Smoking, very important, or any form of tobacco. And smoking and alcohol apparently has about 30 times higher rate of developing cancers than those who don't smoke and have alcohol. And of course, in India, one of the oral cancer is one of the top 3 cancers. And betel nut chewing with tobacco is one of the major concerns. And now, human papillomavirus infection. This is a sexually transmitted virus. And this oral cancers due to HPV infection has increasingly been seen in young children when they get involved in sexual activities. That's why now CDC recommends HPV vaccination in preteen kids. That's very important. And genetic syndromes, certain genetic syndromes can predispose you to cancers, poor nutrition, ultraviolet light, especially the lip cancers. And age is also another factor. So advancing age is a risk factor for cancers. But so because of that, when you see cancers in a younger population, it's more resistant and it's more difficult to treat. And when in your normal examination, when you see things like this, like the white lesion in the tongue, or any white or red lesions, or any other discolorations in the oral mucosa, these are all warning signs. We sometimes it's just a precancerous condition. It's not changed to cancers, but it's a precancerous condition which can be just treated by just cutting off that part. Whereas if it is gone to cancer, then you need extensive treatment. Sometimes you need to remove all the, you have to cut the jaws, cut the tongue, you have to remove the lymph nodes in the neck, and then reconstruction. So it goes into very extensive treatment. So detecting early is very important. Again, I have to stress that, or you can see a swelling in the neck. Now, what are the symptoms that you want to look out for? A non-healing ulcer. Okay, in 2 weeks, you have, most people get ulcers, which we call recurrent aphthous ulcers, but that comes and goes. But there are other kind of ulcers that does not heal. If it stays, definitely see a dentist or an oral surgeon. Or red and white patches in the mouth, swellings anywhere in the face, mouth, neck region, or persistent sore throat. You feel that something is caught in the throat. Suddenly you feel numb lip, tongue, difficulty moving your lip, tongue, and difficulty swallowing. And you've been wearing a denture, suddenly it doesn't fit. Could be various reasons why it doesn't fit, but definitely get it assessed. And unusual bleeding from the teeth, loosening of teeth, or again, unexplained weight loss of the teeth. I just wanted to share with you to show that how extensive oral cancer treatment can be. You can see the resected part of the cancer, and then the neck, all the lymph nodes are removed. And this is what you see in the middle. That's the workhorse of now reconstruction that I talked about. Now we don't just take tissues from one part of the body to another. We do microscopic surgery where, like you can see here, the fibula bone, that is the bone from the leg, is taken along with this blood supply, and that blood vessels are connected to the blood vessels in the neck. So it's a very extensive kind of surgery. I have been through surgeries which took like 17 hours. So these are the kind of work that we do to help save the patient's life. Now, oral cancer screening. What is the key? It's the key to that is prevention and early detection, right? It's very, very important. And you become aware of the causes and early symptoms because the survival outcomes are very different when you detect an oral cancer in stage 1 versus stage 4. And people who smoke and drink definitely need regular checkup, and HPV vaccination for preteen boys and girls is also very important. Now, we do face some challenges. Just a few to mention is one of them is dental phobia, right? I've seen so many people telling me, doctor, I love you, but I don't generally like the dentist. And are, as I said, it could be because of a bad experience, or generally dental anxiety is very important and something that we face on a day-to-day basis. So there are different modalities to tackle this. We can sedate the patient, give them oral sedation or IV sedation, counseling. Your approach to the patient is very, very important in calming down the patient. I have seen a lot of anxiety attacks. So I mean, basically, you need to control. You need to tackle those patients. So and in really difficult patients who cannot be tackled, you can have nitrous oxide sedations like laughing gas or IV sedations. You have to do the procedures under IV sedation, and sometimes you need general anesthesia as well. Patient to be completely unconscious to do the procedures. Another challenge we face is the increasing cost, and because the dental insurance coverage is not comprehensive, medical insurance does not cover dental insurance. A lot of problems with that. So even if it is your out-of-pocket pay, I would suggest that you take whatever fits, makes it important for you. Maybe you should take an insurance that covers the most expensive treatment. And see, your dental needs are different. Each person's dental need is different. So you can probably take an insurance that that supports your need. Okay. And another very important aspect that we face in dentistry is unethical practice by certain dentists. And because of that, the whole profession is being black marked. They say that, oh, the dentist said that you need this treatment, that treatment, but then when I consulted another dentist, that was not needed. So a lot of checks and measures are in place to control these unethical practices by dentists, but, dishonest people are there in every profession. And I'm sure in many other medical professions also this happens, and that happens in dentistry as well. So make sure that you go to a dentist who is very well trained, who's honest, and who can take care of your dental needs in a very ethical manner. Now we talked a lot about dentistry and the general fields of dentistry and how dentistry affects your general health and oral health. So practicing some good oral hygienes and habits at home is very important to keep your teeth and surrounding structures clean. And one of the most important things is brushing twice a day. And I don't know how many of you do that, but that's very, very important. And flossing daily is also good to get the food particles in between the teeth out, because when you brush, you only brush the outside and the inside surface of the teeth, but it also has sides, right? So that the food materials need to be flossed out from the gums. And mouthwash, use it judiciously. You don't need to if you don't have other conditions, but if you want to feel your mouth fresh, you can use mouthwash. Avoid tobacco, definitely. And sticky foods, that's the most important cause of dental caries. And limit your sugar intake as much as possible. And visit a dentist regularly. For more than a beautiful smile. I hope you all agree with me on that. And that's me there, 5 months pregnant. I'm assisting a surgery. It's an oral cancer resection, reconstruction, neck dissection. So this is one of the surgeries that I said I stood for 15 to 17 hours. Thank you.
Thank you, Doctor, for that beautiful presentation. At this time, we're going to open up to any questions. We're going to start the Q&A portion. If that's okay with everyone. If you have any questions, you can just directly unmute your mic and do so. Otherwise, I have some questions sent to me I can read. Okay, I'll start reading the first one. First question is, what is oil pulling? What are the pros and cons of oil pulling?
Oil pulling, okay. That's something that I think was traditionally probably used in India, I'm not sure. that you basically most people use coconut oil about a teaspoon of oil you put inside the mouth and swish it around and keep it for about 15-20 minutes. It is supposed to reduce bacterial load and improve the gum conditions. But I don't think there's any evidence-based studies. There's evidence-based results on the advantages of oil pulling. So I don't think American Dental Association recommends oil pulling as a treatment, but and I also don't see any disadvantages of using that. Probably some dehydration because you're using oil in the mouth, but no established evidences for its usage. Did I answer that question?
Yeah, because me myself, I've never heard of oil pulling before.
Okay.
Yeah. Another question we have here is this is interesting because this is very popular amongst the youth. Mewing. I don't know if you've ever heard of mewing. MEWING. It's a
No.
form of oral posture training. It's when you rest, it involves placing one's tongue on the roof of their mouth and applying pressure with the aim of changing the structure of the jaws. So all day they'll put the tongue on the roof of the mouth, hoping to change the structure of the jaw. The question is, I have heard that this helps with sleep apnea. Have you heard about this practice, and is there any truth to this?
I have not. I don't know if Ranjini has anything to add on that. I have not personally, but definitely your tongue and related structures play an important role in changing your jaw structure. That's why we use myofunctional appliances earlier in life to change the jaw structure. But I've not heard of this term mewing. Ranjini, you have?
So I'm actually looking at the description that's been posted in the chat, and it says the controversial British orthodontist who created the technique. Honestly, I don't think in all my years of practice in comprehensive dentistry, which is I do all these fields. So I do practice specifically, and I do orthodontics too. No, it's too short a time, and it's so interrupted. Then in that case, people who have tongue thrust, the teeth should just fall off of their mouth, which eventually it will. But I don't think it is the forces are just with pushing up against the roof of the mouth, you can prevent sleep apnea. Sleep apnea, tongue does have a very important role in sleep apnea, where when we sleep, our tongue, when it's relaxed, it falls backwards and it does close the pathway. So there it is. So we do repositioning of the mandible, as a treatment, that's the appliances we make to reposition the mandible to help in the treatment of sleep apnea. But no, I have not heard of mewing.
Okay, another question I have here is it important to floss daily, or is it fine for me to just brush my teeth every day?
Yeah, flossing is important, although I don't see any studies that specifically say that flossing has tremendously improved the outcomes, but as an adjunct, that means flossing is just not enough. You need to brush and floss. Together, it's definitely improving the outcomes in oral conditions. So yes, at least once a day, especially if you don't have time in the morning, maybe it's better to floss at night when you have more time. So that is important.
So can I add there, Deepti, with your permission?
Sure, go ahead.
So Deepti is more of a specialist, So she does all high-level stuff. I'm more of a, like I said, comprehensive care, preventive dentistry type. That's why I want to say something about flossing. It's absolutely important that you floss at night, because when you think about a tooth like this, the tooth has all these surfaces. With the toothbrush, you can take care of 1, 2, and 3 surfaces. There are 5 surfaces on a tooth. You cannot take care of the surface in between. The bristles don't go in between the teeth. So it is important to, with the floss, you wipe these surfaces between the teeth. So you should floss. And what Deepti said is absolutely right. Floss at night, because that's when you have saliva pooling in your mouth and you're not eating, you're not drinking, nothing happens in the mouth. So bacteria tends to grow at that time. So definitely do floss. Please floss.
Thank you, Ranjini.
What about water floss?
So water floss is good. With water floss or the water pick, that forced water jet, it does not remove the plaque. What it does is it will take out all the food stuff. Now, if you have a lot of crowns and ridges and implants in your mouth, then food can get stuck between your teeth. And yes, definitely, water pick, water floss is a good thing. But definitely, if you can physically remove the plaque, that is better than the water floss.
Thank you.
I just wanted
Sure.
to add one more point there. As Ranjini said, that you're cleaning in between the teeth, right? So some people have gaps in between the teeth. So we use interdental brushes. So interdental brushes have literally shown very good results in articles, in studies. So interdental brushes are also very important in maintaining good oral hygiene.
There's a question in the chat, Anandan.
Yeah, there's a
Implant,
few.
about implant.
I don't know if that's a question or a statement.
So she's asking, implant is important when someone loses teeth, not naturally. Empty space cause any issue? I think it's posed as a question.
Okay, yeah.
Any advice flossing around crowns also?
Yeah.
So you want to talk about that, Deepti? Does empty spaces between teeth cause any issue?
Yeah, definitely, because you know, when you have an empty space, the teeth next to that has a tendency to move towards that and that empty space. So it tilts, the teeth tilts, and it basically messes up with the way you bite, and that can ultimately cause problems with the jaw joint. So some kind of support is needed to keep that space like that, so that everything maintains a space. So you can have different options. You can have dentures, you know, flippers, or fixed restorations. And more important now is implants. So that's why implant becomes so important. So it can stand on its own. Whereas earlier when we do crowns and bridges, you have to cut supporting teeth, which are healthy teeth, in order to place the crowns, right? So now if you have implants, it stands on its own as a single unit. Without damaging other teeth. So these are all different ways to maintain that space.
Now I have one more question here. Veneers are very common in the world now. The procedure includes shaving down the person's actual teeth. Does this have any adverse health effects?
I don't do veneers most of the time. I can say that veneers are mostly for it has cosmetic effect, and also patients with very bad staining. You know, it improves their appearance a lot. So veneers are used regularly, and yes, it needs some shaving of the teeth. One of the thing is with veneers is sensitivity of the teeth. So if it's not really needed, you don't have to do it. But probably Ranjini can say more about it, because she does. I'm sure she does veneers and other cosmetic procedures.
So veneers are usually done, like Deepti just said, when there are like very bad discolorations, which is intrinsic to the teeth, which means that it is not something that can be removed from the outside. So when the whole tooth structure itself is discolored, we do veneers. Veneers are also done in cases where part of the tooth is chipped off, and you don't need to cut the whole tooth. It's pretty much like a mini crown. Now, it's not imperative that you cut the teeth in every situation. You can place veneers without cutting the teeth on enamel when people have small teeth like peg-shaped laterals, and they have a lot of spacing between the teeth. And some people tend to do it when they don't want to do braces to fix their teeth. Then also that's done. So is it bad for you? I wouldn't say it's bad. But definitely, if you grind your teeth and stuff, veneers will chip off too. So I would always advise somebody to do, unless if the tooth itself is discolored, they don't have any other way to change the color of it.
And we have a question in the chat. How to control biting teeth?
Do you mean grinding of the teeth?
I think they meant grinding of the
Okay.
teeth, yeah.
So grinding of the teeth is a habit. Oh, Deepthi, do you want to touch on it? I'm sorry.
Go ahead, it's your field.
Okay. Okay. Grinding of the tooth is a habit. So it's basically a neuromuscular phenomenon. You can't control it. During the daytime, you can control it by being aware of it and doing behavior modification. But at night, there's no way. Most of my patients that I see who grind their teeth do it at night. And at that point of time, we place night guards. And honestly, if any of you have been advised to get a night guard or an occlusal guard, please get it. That's the best insurance you can get for your teeth, because you have no way of controlling this grinding at night. Then you stay awake and hold your jaw and say, don't grind, or get a good night's sleep. So I would rather that you get a good night's sleep than worrying about your grinding. So get a night guard. Your dentist will be able to make you a custom-made one, or there are good ones available. There are even ones available in Amazon. So definitely, if you've been advised, get some. And there's
Yeah, a few more
what
questions.
should be the cancer screening frequency if we don't smoke or drink?
I would say that whenever you visit your dentist, I'm sure you visit maybe every 6 months. If you don't have any ongoing issues, you have a visit every 6 months, because in 6 months, things can change. So that makes something that was not very obvious. In a few months, things can change. So I would say that every 6 months, you visit a dentist, make sure that everything is all right, and get a free cancer screening as well during the time. I mean, that will be automatically done by the dentist when they do their regular checkups.
Periodic exams. Yeah, that's correct. It's usually involved in your exam. There's another
I was
question.
yeah. Sorry,
Go
I
ahead.
just wanted to add. I was just asking because my dentist, they recommend this once a year, and sometimes I'm like, no, I don't want to do it this year. Maybe I'll do it next year, kind of a thing. So that's the reason I was just asking.
Aisha, can I ask you, are they asking you to do a Visilite screening?
Yes, yeah, the light thing, yeah.
Yeah. You know, some people do say do it every year. Do you think you have any predisposing conditions why you need to be screened every year?
No. At least I don't
Then-
know of anything, yeah.
Then I don't think it is imperative that you do it.
Okay. Yeah, because they charge me because my insurance, I think, doesn't cover, and then they put an extra charge. So I'm like, maybe I won't do it. So yeah, thank you, doctor.
You're right. There's another question. Over 30 years ago, I had bridges and now implants. May I share my experience? I think it's Revichetan. Dr. Nishapala is here. And like she said, she's a stickler for punctuality. Can Revichetan just ask that?
He can talk. That's fine. Rachita, go ahead.
Go ahead, Revichetan.
Maybe
Yeah.
expert
Oh.
opinions on the side.
30 years ago, we had very good insurances. Now the coverage is different. People have experienced different. But from my wife's side and from my side, we had good insurance. And when we came, I had a bridges implanted on both sides of my jaw, lower jaw. And afterwards, I felt that it should not have been done because of the lack of my knowledge, because food used to be stuck in underneath the bridge, as Ranjini mentioned. But it took me a while to get it cleaned. Then last 4 or 5 years ago, I had removed all those bridges and implant done. I felt a lot of relief after getting the implant done. So bridges versus implant, you have to think through, talk through, and then decide which one you need. For me, about 25 years, I had bridges. Afterwards, now I have implant. And my experience is that implant is far better because you are not cutting healthy teeth. Implant is only affecting that diseased or bad teeth you are removing and putting the implant or you are capping it. And so think through it and do it. Discuss it, do it. That's only my suggestion.
Excellent anecdote, Vijeta. Excellent. You just touched the heart of that topic. You know, with bridges, yes, cleaning is a big problem. Going under the bridge, under the pontic that we call, that's a missing tooth, and cleaning is a problem. And also with bridges, it doesn't replace bone. Where with implant, it stops the dissolution of the bone. So definitely implants is better, but 30 years ago you had it. 30 years ago, implants were not so advanced. Back then you got the state-of-the-art care. So you took care of your teeth. That's why you're able to do implants now. So that's very important. Taking care of one's teeth is very important.
Yeah, that's true. Thank you. I never had teeth pain. So every year, twice a year, I used to go to the dentist, and similarly the doctors also. So health-wise, I do take care of. Thank you.
Good to hear that. Really good to hear that. Thank you.
Okay, so I guess we're done with our questions, right?
Yeah.
Really want to thank Deepthi for, I know you are really struggling to run to your fellowship now or your next training.
Residency training.
The residency training. So it was truly a pleasure to have you here. And I was just trying to sneak you in June itself before your July thing starts. Congratulations on the new thing. And, of course, I know it's an eye-opener for all of us that there are so many different dentistry fields and there are so many things, outside of in just pure smile and aesthetics. But obviously, what I loved was like to improve somebody's mental health. It's important to go see a dentist, okay? Because if you really have a bad mouth, your mental health is also affected for sure. So that part is, but there's a saying among doctors that if the beginning of your food pipe and the end of your food pipe is in good health, you are really in good health. Which means if your bowel habits and your mouth is in good health, 90% of your illnesses will be taken care of. That's a point on the side as well. But thank you for that phenomenal talk, because I think it was an eye-opener for a lot of people here that it's beyond all that, the regular stuff that we think of in a dental office or something. And Ranjini, I also want to thank you for coordinating this event as well as pitching in as an expert person on the side along with Deepthi. I guess a lot of questions were taken by Ranjini also, so we will have another talk or some other session that everybody.
I told Ranjini earlier itself, I don't practice dentistry outside, and probably I'll need a lot of help because I'm more focused on oral surgery and its related treatment. So
right.
not doing general.
That's fine. We'll, like I said, when we have these sessions that we identify there is a lot more to talk about it, and that's how we open up new topics. Anyways, it was phenomenal having both of you, and then you were a great host for the day.
Thank you.
Thank you for your time. And where is my little Parthiv? Parthiv, you opened it up so beautifully, my dear.
Thank you on behalf of Parthiv. He had to run for a camp. So,
okay. So we'll have the formal vote of thanks, and all of you who join every time to make these sessions lovely, vibrant, and important. It's almost 6 months now that we have weekly programs going on. Really want to thank all of the coordinators, all of the people who put their efforts to make these things happen. And I'm sure we are talking a lot more than religion or everyday things that's important and make a difference. So thanks all of you for joining in, and we'll go for a formal vote of thanks now.
Okay.
And then are you doing it or Ranjini is doing it?
I'm doing it.
Okay, good.
So first of all, I want to thank Dr. Nisha Pillai, who has been having these sessions pretty much every week. I don't know how she gets this energy to do all these things, and she tries to be there for every session too, and it's awesome. It's amazing. She caught me on a day when I don't work. I sometimes work on Saturdays, and she's like, "Are you going to do this?" And I said, I cannot say no to Nisha either, So thank you so much, Nisha. I was able to attend the meeting on tax, and that was some eye-openers too. So you keep having these sessions. Awesome, so very good. Deepti, that was the gist. I mean, nobody could have run down on comprehensive dentistry, the various fields, so fast. You did great, and as everybody now know, you're a specialist, and you're training to be another specialist. But how you explained about comprehensive care with finesse and expertise, hats off to you. Thank you so much. Thank you to Parthiv for the soulful Kavita. Please convey our thanks to Parthiv. That was soulful rendering of that prayer, and you could so well see his energy there. What a beautiful prayer that was. Now, thank you so much.
We really appreciate the opportunity. Thank you so much.
He's so good. He's too good. Now, thank you so much to our vibrant youth here, Anandan Rajiv. Anandan's field is not dentistry. And when requested, he said, sure, I'll do it. And I mean, his energy and the KHNA youth's energy is immense. Thank you so much, Anandan, for hosting or emceeing today's event and like picking up on the request. Thank you so much.
Thank you.
Now, thank you for all the questions. Thank you for all the questions that was asked. Honestly, that presentation was so good, but there were like so many areas where I know for sure that Deepti left open so she could get some questions out of it, and she would only touch that area if it was of interest. And thank you for showing your interest and making this a very good interactive session where we were able to explain dentistry in a little bit more detail. And at any point of time, you have any questions, definitely, I know most of you know how to reach Deepti or me, and we'll be there for you. Thank you so much to everybody who participated today, everybody who's here, and let's call it a day. Thank you.
Thank you. Thank you again, Nisha and KHNA, for giving me this opportunity. Thank you. And thank you everyone for joining in. Thanks.